Members of Access Dorset have been given an opportunity to look into changes occurring in health and social care. There is a recognition that patients should have more control, and we want to find out what that really means, how it will work, and what help is available for patients in Dorset. Being in control needs to include the opportunity to have our say about the services we receive. But do we know where to go for that?
I really don't know. Maybe online or something?
The MP, presumably.
Not really, only the MP.
That's quite difficult, isn't it?
I would go to a local hospital and talk to someone there, or local council maybe.
No, haven't got a clue. Doctor maybe, or friends.
To be a patient in control, we need to have our voices heard and have a say in how health and social care is run. For instance, if I wanted to say in how my GP surgery is run, where would I go?
Interested in how we can use our voices at a local level, I went to chat to Malcolm Parsons, who told me what we can do through our GP practice.
I'm a member of the Patient Participation Group, which is a bit of a mouthful, so we call it a PPG. It's basically a group of patients coming together very much for selfless reasons, because they want to improve things for the patients of that particular practice. We meet on a monthly basis to consider what is going on in terms of the experience of patients at that surgery, and we have regular sessions with the partners to share that and explore ways in which things can be improved.
So could you give me an example of a positive outcome from the work that the group does?
Just getting access to the surgery. It used to close at lunchtimes, but we actually demonstrated that there would be benefits all round if they were to open at lunchtimes. That's been a tremendous success. Patients can go in during their lunch hour to collect a repeat prescription, no hassle. Previously, there would be a queue, and the queue would be people who had got a 2 o'clock appointment, who wanted a repeat prescription to get back to work. So now the receptionists are not faced with the disgruntled queue of customers at 2 o'clock.
So if I was considering getting involved in my local PPG, what words of encouragement would you have for me?
If you've got time and if you've got an interest in trying to improve things, not for yourself, but for the patients in that particular area and of that practice, then the first thing to do is either look on the website of the practice to see if there's any information about the PPG there, or if that fails, to talk to the practice manager at the practice, who will have information about the patient representation. But certainly if you want to do something rather than just either accept it or moan and accept that nothing's going to change, but if you want to actually make a difference, then by all means, it's worth following through.
So, Malcolm was pretty clear that a PPG is a great way for me to have a say about how my GP practice is run. But what about the broader range of services like hospitals and social services? How do I get a say there? To find out more, I went to visit Martin at HealthWatch Dorset. So tell us a bit about HealthWatch.
Well, HealthWatch is the independent consumer champion or watchdog for health and care. There's a national organisation called HealthWatch England, and then there are 148 local HealthWatch organisations, and HealthWatch Dorset is one of those. The principal aim of local HealthWatch is to give local people a stronger voice, to influence and to challenge how health and social care services are delivered locally. And also we give information to people to help them to make choices. Most people don't think of themselves when they're using public services, including health and social care services, not really thinking of themselves in terms of consumers. But it can be helpful too, because we're aware that as consumers we have rights. It's not so much that we're, if you like, passive recipients of health and social care services, but really we want people to feel that they're active participants. to really be able to make a difference, we think that we have to choose some particular things to focus on and do some particular pieces of work. So we decided to do something that was focused on GP practices locally and to find out what it was like to ask your GP practice how you might go about raising a concern or making a complaint. And the way that we did that was we did a mystery shopping exercise.
My name's Eileen Mitchell and I'm a HealthWatch champion for HealthWatch Dorset. There were 10 volunteers altogether and we visited every single GP surgery across Dorset. We'd had a briefing beforehand to guide us in what we should do and what we should say. So from my perspective, I went into several surgeries around Weymouth, Portland, Dorchester area and asked the question, could you tell me please, what would I do if I wanted to make a complaint?
We did make a few recommendations for how some of the practices could improve, which might be about more readily available and accessible information in different formats.
One surgery really embraced it. They got together all their staff and they looked at what we'd been saying and they've put together a leaflet and it's absolutely fantastic. It's accessible on the website, but it has all the information that any member of the public would need. But also they included HealthWatch. They had them look at the draft version before they actually went with the final version.
Every single person matters and every experience matters. It doesn't matter who you are, whether you're part of the majority or part of a minority, you matter, your experience matters and your voice has a right to be heard.
So, from what Martin tells me, HealthWatch makes a good advocate. But what if you want a direct line to those at the very top? Last year, Gary, an NHS Dorset Citizen journalist, investigated a new initiative by NHS England called NHS Citizen. I went to his hometown of Weymouth to ask him about it.
So since I became a citizen journalist, I've taken an interest in the mechanisms that exist to give people a voice. And last year came across NHS Citizen.
So let's start with the purpose of NHS Citizen. It's about trying to find and connect the public conversation that's happening right now about the NHS.
So in designing NHS Citizen, what they did was go all around the country holding workshops, design workshops, and they filmed each of those workshops. I've watched all of those films in an effort to try and understand what NHS Citizen is.
Our scope is the board of NHS England wanting to listen more effectively directly to patients.
It's trying to gather as many voices as possible so that people who do make decisions, which will always be the NHS board or NHS commissioning managers, have the biggest set of public views and public information to work on.
It was really hard at first to put my finger on what NHS Citizen was when I started looking at this.
It isn't an organisation. There will never be a chief executive of NHS Citizen. It's a way of working and connecting all of the other things that are going on.
Really what it is, it's a system. They've been looking at creating a system which will discover what people's issues are with the NHS, discover what conversations are happening about the NHS, you know, take a lot of topics that are being discussed and feed them all into one space, and then people will gather around those particular topics and debate them out, provide evidence for them, and they'll become a well-rounded topic that you can then feed to the board of NHS England. It's in its early stages, but if it works, it's going to be a really good opportunity for people like me and people like us to have a voice and use our experience and feed that in and affect real change. I mean, that to me is really exciting.
So we've discovered that our channel's open to us and people are listening, but it won't just happen. If we want to be heard and make a difference, it's up to us to use our voice and share our experiences.